Alameda County Public Health presents a Command Summary Update for 60-Day Anthrax Response. Anthrax is a deadly infectious disease caused by Bacillus anthracis bacteria. According to the Department of Homeland Security, anthrax is the most likely agent to be used in a biological attack because only a small quantity of spores can infect a large number of people, causing massive disease outbreak and death. The number of casualties could range into the thousands. Immediate intervention with post-exposure prophylaxis is necessary to protect potentially exposed populations. Because of the public health threat posed by an anthrax event, national experts have evolved a multi-phase plan that depends on your leadership in command roles to be effective. Current guidelines call for a 60-day response program, beginning with rapidly deployed oral countermeasures. Medicine will be distributed from the Strategic National Stockpile, or SNS, in phases under the direction of ASPR, the Assistant Secretary for Preparedness and Response. Initially, the SNS will deploy a 10-day supply of medicine to affected jurisdictions. This will be followed by a 50-day supply of medicines, and finally anthrax vaccine to complete the 60-day oral and vaccine courses. Our mission is to provide everyone at risk with 10 days supply of oral drugs within the first 24 to 36 hours. Before the end of 10 days, we will distribute an additional 50-day supply of oral medicine and begin vaccinations for a total countermeasure deployment of no less than 60 days. The Alameda County Public Health Department has been working with city, county, and other stakeholders on plans to meet the 24 to 36 hour first response target. As a public health responder, your knowledge of these plans and the process of deployment is critical. And as always, preparedness is your biggest advantage. It should go without saying that local officials will be the closest to an incident and will have a lead role in response operations. If you do not feel prepared for a mass public health emergency, now is the time to coordinate and improve your readiness and response plans. Invest in pre-incident planning with the Alameda County Public Health Department. First, it is possible that it will take time for an incident to be recognized as a mass public health emergency, and we all hope that this time will be minimal. But once a public health emergency has been recognized, clearly defined processes for rapidly responding with both public sector and private sector partners will kick into action. As a part of the City Readiness Initiative, the Bay Area already has assets in place ready to go, and we must be ready to receive them and securely transport them to pre-identified points of dispensing, or pods. Our priority is a rapid and seamless transfer of medical countermeasures from federal stockpiles to the people who need them in Alameda County. Pods will be open 24 hours a day and staffed in 12-hour shifts. Together, city and county officials have identified and evaluated many potential pod sites. While most cities in Alameda County have 1 or 2 pods within their city limits, some have as many as 8. Pods open to the public are generally set up at school gymnasiums and big auditoriums where large numbers of people can easily come and go. The county has also arranged for closed pods to be set up by large organizations acting in partnership to quickly and efficiently distribute medical countermeasures to their own staff and their families. It is important for you to understand the new chain of custody. As always, ASPR will deliver medical supplies to designated state receiving, staging, and storage, or RSS facilities, who in turn deliver to the county RDS or regional distribution site. The new packaging system used by the Strategic National Stockpile bundles one medicine on a single wrapped pallet as part of the same lot number and expiration date. This allows us to deploy full pallets of medicine much faster. We no longer have to break down and scan every container to match lot numbers with individuals. If we know where a person received their medicine, we will automatically know their lot number. Of course, it also makes it that much more important to track the pallet lot numbers correctly. This strategy of providing preventative medicine to the exposed while still healthy is called post-exposure prophylaxis, or PEP. The most extreme bioterrorism threat, and the standard for which we train, is biological attack using anthrax. Bioterrorism is the intentional release of viruses, bacteria, or other germs that can sicken or kill people, livestock, or crops. In any biological attack, time is critical. In vulnerable individuals, anthrax symptoms may begin to appear as early as 1 day. So in an anthrax attack, emergency treatment must begin as soon as possible. Mass distribution of prophylaxis needs to be completed within 24 to 36 hours. Planning to treat an entire urban community within the target of 24 to 36 hours is a significant challenge that requires everyone to perform their duties quickly and efficiently. Simply said, the more people who we treat in the shortest amount of time, the more lives we potentially save. But be aware that to make this happen, you will need to change your normal operating procedures. In the event of a release of weaponized or aerosolized anthrax, we may need to distribute medicine to everyone in the county, both citizens and visitors. In Alameda County, this means treating 1.7 million people in under 2 days. To aid in this mission, whenever possible, first responders and their families will be given priority access to medicine. As soon as supplies arrive, you'll immediately be provided medicine for yourself, and if take-home prescriptions are involved, additional medicine for those living in your household. But you must remember that in emergencies, communications and transportation may be limited. If for any reason you are cut off from home, you can help your family most by ensuring the fastest care for everyone in your area, and trusting that your family will be receiving the same from others. Your public health officials will be your first resource for information. And while you may not be in the habit of including them in all of your responses, it is critical that you embed them in your command chain during a bioterrorism response. Now let's look more closely at the 60-day emergency response plan. Within 12 hours of the decision to deploy, ASPR and the state will deliver SNS shipments to the County Health Department's Regional Distribution Site, or RDS. The Alameda County RDS will receive pallets of medicine bottles, each containing a 10-day supply of antibiotic tablets, such as ciprofloxacin and doxycycline, abbreviated as Cipro and Doxy, along with a small amount of liquid antibiotic suspension. These are to be distributed and taken by the affected population within 24 to 36 hours. This completes Phase 1. Immediately following delivery of the 10-day supply, ASPR will begin deploying the 50-day supply. In addition, they will deliver appropriate countermeasures for hospitals and other healthcare settings. For anthrax, these include pediatric antimicrobial oral suspensions, adult multi-drug courses, IV antimicrobial drugs, antitoxins, and ventilators. Cipro and Doxy are FDA approved. However, for SNS deployment, they will be distributed through the Emergency Use Instructions regulatory mechanism, covering dispensing, packaging, labeling, shelf life extension, and other instructions like pediatric crushing recommendations. Local jurisdictions should make sure to include emergency use instructions in their public communications. Amoxicillin is not an FDA-approved treatment for anthrax. However, for allergies or susceptibility to side effects, amoxicillin capsules are the preferred alternative treatment. Amoxicillin is also the preferred antimicrobial drug for pediatrics, but due to supply limitations, should be prioritized to children ages 1 through 8. However, amoxicillin is not recommended for pregnant or postpartum women unless there is no alternative. The quantity of amoxicillin in the SNS is limited and will not be included in the initial 10-day deployment. So everyone, child or adult, is to take the initial Cipro or Doxy supply unless they are known to be seriously allergic. Amoxicillin also may not be packaged in individual unit of use containers and will need to be repackaged for distribution. There is also a vaccine available for anthrax. It is FDA approved for adults age 18 to 65. The CDC recommends that entire affected populations be vaccinated, along with the 60-day oral Cipro or Doxy regimen. The first vaccination should occur as early as possible, with a second shot at 2 weeks and a third at 4 weeks post-exposure. But, like amoxicillin, the vaccine is a limited resource in the SNS. Recognizing that the supply may be insufficient to immunize everyone in the affected population, CDC recommends a 3-tiered prioritization based on exposure. Tier 1 includes high-risk population present during primary exposure. Tier 2 includes medium-risk population potentially contaminated through secondary exposure. Tier 3 includes low-risk population living in border areas at progressively increasing distances. Like amoxicillin, anthrax vaccinations are not included in the initial rapid response deployment, but will be included in the 50-day supply deliveries. Note that the vaccine requires refrigeration, so there will need to be a cold chain record. Additionally, anthrax vaccination cards will be included for every person to track dosage, dates, and details. 1 card per person. And normal childhood vaccinations should not be co-administered during the 60-day emergency period. So, to review quickly, your mission in a mass prophylaxis emergency is to get pills into people as soon as possible. Speed equals survival. Once an emergency is recognized, ASPR will activate the Strategic National Stockpile and deliver a first round of antimicrobials within 12 hours. These will be single-lot pallets of individual unit-of-use bottles containing a 10-day supply of tablets of ciprofloxacin or doxycycline. As quickly as possible, these must be distributed to points of dispensing pods as the primary method of getting them to the public. The emergency response will last at least 60 days and be rolled out in 3 phases reflecting the delivery of medicines. Phase 1 is the initial rapid response, which requires staffing, supplying, and activating points of dispensing on 24-hour schedules. Every person in an affected area must be given a bottle within the first 24 to 36 hours. Only those who are deathly allergic to ciprofloxacin or doxycycline will be directed to quickly go to a hospital to seek alternative treatment. Immediately following the delivery of the 10-day supply, the SNS will begin delivering 50-day unit-of-use bottles of ciprofloxacin or doxycycline. Phase 2 of the emergency response covers the remaining days of the initial 10-day period, during which pods must finish distributing the 50-day unit-of-use supplies. These must also be distributed to the entire population before the 10-day supply is used up. Children may require adjusted amounts and tablets to be crushed in order to get their proper dosages. Pediatric dosage and crushing information is available from the CDC website, but should also be made easily available locally and at pods. The regional distribution site will be busy distributing appropriate healthcare support supplies, including pediatric oral suspensions, adult IV drugs and antitoxins, and ventilators. At the same time, available supplies of amoxicillin and anthrax vaccine will arrive and need to be repackaged, prioritized, and distributed according to jurisdictional needs. And the RDS, local transports, and the pods will all need to be prepared for secure cold chain storage and transfer. Refrigerated vehicles and portable refrigeration units will need to be deployed along with cold packs and coolers. Phase 3 of the emergency response provides continuing support for the remaining 50 days of the treatment cycle. The RDS will be busy distributing supplies according to the priority directions from the Emergency Operations Center. Subsequent refrigerated vaccines will be delivered along with shifting resource allotments of emergency medicines and equipment like ventilators. The pods will be busy administering vaccines and replacing lost or damaged 50-day Doxy and Cipro supplies. Maintaining the functions of the pods may become the easiest parts of the emergency to manage as hospitalization and death become increasing concerns. We already know that people respond differently to anthrax depending on exposure and their immune systems. For especially vulnerable people, 24 hours may even be too late for effective countermeasures. The tragedy of loss of life may quickly become the primary focus of the command response. It is impossible to predict. But whatever occurs, understanding and preparing for the process outlined here, and then fulfilling it to the best of your ability, will make all the rest that follows easier to address. It also goes without saying that communicating this process to the public is another critical component of the response, not addressed here. As for the conclusion of the 60-day course of response measures, closing the emergency facilities and proceeding as needed will occur according to protocol. Once delivered, medical countermeasures become the property of the jurisdiction to which they are sent, and cannot be returned to the national stockpile. Exceptions to this include any unused assets maintained under federal control or durable products, including ventilators, aspirators, cargo containers, and other movable containers, which are expected to be returned to the SNS inventory anytime during or following the response. We hope this information has been helpful. The Alameda County Public Health Department thanks you for watching this presentation. Additional training for general overview and RDS staff, along with individual section leaders, is available in other modules. Your participation and continued training for public health disaster response helps ensure that we are as ready as we can be when our citizens and our communities need us. This video series was brought to you by the Alameda County Public Health Department Office of Emergency Preparedness and Applied Creative Training.